coronavirus numbers. This week, 25 states reported more cases than the previous week. On Friday, more than 54,000 new cases were reported. That's the most in a single day since mid-August. There are now more than 7.3 million known infections in the U.S. The death toll has climbed to more than 208,000. Here to discuss the president and more is CBS News contributor Dr. David Agus. Good morning, Doc. Yeah, reports are that President Trump is experiencing mild symptoms, low-grade fever, and a cough. What will his treatment at Walter Reed look like?
You know, when he started and tested positive and started to have mild symptoms, the first thing they did was they gave him an experimental drug, a cocktail. So two different monoclonal antibodies mixed together. So they were taken from a patient that had gotten better, and they were basically cloned and grown up as a drug and administered to him so he could fight the virus. They would bind the spike protein and block the virus from getting in the cell. And then yesterday evening, he started a daily course of remdesivir, another intravenous antiviral medicine, as well as what we call supportive care. Make sure he has enough fluids and make sure all the numbers are correct as they follow him in the hospital.
So the president's 74 years old. He is technically obese. How does that factor into not only his treatment, but his prognosis?
You know, both of those are certainly risk factors, although his biggest risk factor is being male. Being male is the biggest risk factor of all of them, but they certainly put him at a higher risk for complications of COVID-19, which is why I think they're doing very aggressive therapy, antiviral, and the monoclonal antibodies to block the virus.
You know, former Vice President Joe Biden was, 10 feet away from the president. Also, Chris Wallace, closer to him than the audience members. But how concerned should people be about, or doctors, we should say, about Joe Biden and his risk to coronavirus?
You know, there's always risk. I mean, you can never bring risk to zero, especially when someone has the virus. What we do know is that on Tuesday, the day of the debate, they were all tested, which a probe went to their nose, and there was no virus there by a very sensitive test. That doesn't mean they didn't have the virus, but it probably means they weren't infectious. So I'm not as worried about Joe Biden. I mean, obviously, the problem with this virus is it doesn't discriminate. And so if you get enough particles, you will get sick no matter who you are.
And a lot of people are questioning this contact tracing. The president is around a whole lot of people, has been in the past, and exposure certainly is where everyone is looking right now. How important is it going to be to follow that line of contact tracing?
Well, critical. I mean, obviously, we've seen a number of cases now within staff in the White House and outside the White House. And, you know, they're actually going back to video. And you say, who did the president interact with at close distance for a long period of time without a mask? Those people need to be put into quarantine as part of the contact tracing program and tested on a regular basis. Otherwise, they can go out and potentially be asymptomatic and continue to spread the virus. If you want to stop it cold, you have to contact trace and you have to act on that data.
All right.